Hi there, everyone. My name is Prerak Juthani. I am currently an internal medicine resident at Stanford, and today I want to show you how I utilize Anki in residency because it's been very helpful, even if you don't necessarily do it every day. So let's talk about it. So next time you see me, I'll be on the small screen. Let's get to it.
All right, so here's the topic of the video. We already mentioned that it's going to be about Anki. Before we begin, if you don't know what Anki is, I have a huge video series just about Anki, how to utilize it, what it is, how to download it, how to get it set up on your laptop. So if you don't know, go ahead and click the video linked right above, and you can also go ahead and click the videos in the description, and those will take you to my entire Anki 101 video database. But now I'm going to talk about how to utilize Anki for residency. And this actually applies to how to utilize Anki across all levels of medical training. Residency is just the next level. And particularly this is important because residency requires you to incorporate your knowledge base of medicine with this entire other world of medicine that you may not have known existed before, such as insurance, discharges, admissions, hospital administration. So there's three parts to today's video. And the way I want to break it down is that the first part of the video has to do with the organization of how I keep my decks in residency, because I do still make cards in residency. The second part is about how Anki is not just about memorizing things, it's also very helpful for keeping your knowledge in one place and having it to access if you need something or have a question about something. And the third part is the onboarding versus the doctoring part of my job. When you're a med student, you're mostly worried about doctoring. You learn how to be a good doctor, make your knowledge strong, get to the next level. But once you're a resident, you actually have to worry a lot about where are you in the entire system? How do you reach out to people? How do you consult people? How do you know where things are in the hospital? How do you write discharge summaries? And all of those things are just as important, if not more important to your job than being a resident, aka knowing the doctoring, knowing the patient care, knowing the ins and outs of the labs. So, without further ado, let me now show you some of the ways we're going to do this, and we'll start first with the organization. My entire Anki is organized, as you can see here, by temporality. So you can see that when I was in medical school, I had one about my clerkships, I had a deck about preclinical things I was learning, and now I have a deck specifically for residency. And even within residency, notice that I have a deck purely for when I was applying to residency and I was thinking about the different programs I was applying to. I have an entire deck for things that I'm learning in terms of clinical problem solving. And then I have a deck entirely for PGY1, which is all about my first year of residency and like the things that I'm going through. If you actually then go into my PG1 year, if I open up this deck, you can see that I have a bunch of additional decks, and each of those decks are also separated by the month and when I did the rotation. So you can see I did a cardiology rotation that's in September. You can see I did a geriatrics rotation in August. And by having the specific rotation and the temporality, it gives me two ways to organize my knowledge. When I make a card, I know the specialty the card is related to, but I also know the time at which I made that card. So if September was a month when I was studying pretty heavily for step 3, I might know that there's going to be some additional cards in there linked with UWorld or USMLE related stuff. On the other hand, if I know that July was a time when I was just starting residency and was really overwhelmed, you'll know that then I know that some of these cards are going to be a little bit more basic and have some basic information behind them. So just some general gist of how I organize these cards within my PGY1 year, because I do make some of my own cards and I also draw a lot of cards in, and each of them has to do with the specific information relevant to that rotation specialty, but also relevant to the time I did that rotation. And now let's pivot into content. The types of cards that I make in residency are still very similar to the types of cards I was making in the pre-residency era. But in the pre-residency era, you had a lot of pre-made decks from people like the Anki and whatnot. In residency, it's a lot more up to you. And the way I like to do it is medicine is a lot. And honestly, in residency, you're thinking a lot more about how to manage patients and what the next logical step is. And while some of that does relate to the USMLE and the things that we've learned in the USMLE, a lot of it is based on the guidelines of whatever society that you're following. So if you just did a hepatology rotation, the Society of Hepatology will have specific guidelines as to when people get liver transplant, when people need to be screened for HCC, what types of people should be vaccinated against X, Y, and Z, and how frequently. And each of those guidelines is well summarized in UptoDate. And for anyone who doesn't know, UptoDate is basically like the Google of healthcare. specifically for healthcare professionals because it tells you the best way to work someone up with the knowledge that you would usually have coming out of any sort of healthcare profession, whether that's PA, nursing, or even medical school. And so you'll see here, I make my own cards still to this day, and I make closed deletions, which means I create a question and I have an answer to that question. But then you'll see underneath, I also include an entire notepad of the things that are relevant to that question and what went into it. And oftentimes I also include diagrams directly from UptoDate that reference the place where I got that information. So you can see here that there are indications and contraindications to a cholecystectomy. You can see that indications include any sort of symptoms. There are also times when people may not have symptoms with cholecystitis, but you still take out the gallbladder. And oftentimes those are things that you learn from your mentors. Those are things that you learn from whoever you're following in the clinic. And as you learn those things, I make flashcards about them because those flashcards allow me to integrate that knowledge in with the up-to-date knowledge with what I learned. And by having these here, even if I don't do the flashcards every day, I can just remember, hey, didn't I have a mentor who told me about when to take someone's gallbladder out even if they were not having symptoms? And then I can look it up very quickly on my iPad, which has my entire Anki database, and I can find this specific card with this specific up-to-date diagram in my specific head that helps me access that information. And I personally find that to be very, very useful. Here's another up-to-date diagram that I turned into a flashcard. You can see that how often do you need to do Cologuard? Cologuard is a new form of testing. It's similar to what people would do instead of a colonoscopy. And the Cologuard basically checks your stool for certain types of mutations as well as bleeding to quantify how likely you are to potentially have colon cancer that you might need to get taken out with a colonoscopy. And this is a lovely up-to-date diagram here that tells you the specificity and sensitivity of different mechanisms of screening for colon cancer. And I just took that and integrated it into my Anki flashcard. This is not something I would have ever done in medical school because this isn't going to be as relevant, but is 100% more relevant when you're an actual resident and you have to decide, hey, should this person get a Cologuard, a colonoscopy, or an FOBT, or should they just get a fit test? Which of these things should I do, and which one would be the best for this specific patient? These are the sorts of questions that are much more relevant in residency. And then you'll see that I also include some of my notes. So here are the notes that I've taken in clinic. Specifically, I learned a lot from my mentor. And when he taught me these things, I just wrote them all down. And whenever I make flashcards, I take a picture of those notes and I upload them directly to the flashcard. So this is the second portion of this video that we were talking about, the types of questions and content that I create using Anki during residency. The first part had to do with utilizing Anki and the way you can organize your decks to facilitate learning. Now, the last part is probably the most important part, which is the most, I think, underrated aspect of residency, which is that residency requires you to not only be a doctor, but it also requires you to learn how to be a part of a huge and insanely complex healthcare system. And part of that is going to be, for example, I work at Stanford Hospital, so I need to know how do I get around Stanford Hospital? What are the Epic Notes templates that we use? How do I write a discharge summary? What orders do I need to put in when someone's hyperkalemic? If someone is not hyperkalemic but ends up having certain symptoms, how do I order things to check if they're hyperkalemic? This entire skill set is called the onboarding in my head. And then the other skill set that you need to have is, okay, if someone's hyperkalemic, what do I do? That has a distinct answer. But to implement that answer, you need to know how the entire system works. And to know how the entire system works requires you to have an entire additional knowledge base, which is also why you need, at least I need, Anki. Because I create a lot of cards related to the onboarding. So let's say I learn what the code is to a lot of the doors in my hospital. Well, I'm going to need to remember that code, and so I created an Anki flashcard for it. Let's say I need to know how to order things for hyperkalemic patients, including calcium gluconate. What order set do I need to do? Where in Epic do I find that? And so I created a flashcard for that. Here's another onboarding thing. When I first learned how to discharge a patient, there were 4 big documents that I needed to know how to write. So what documents are they? How do I access them? Here they are. I created a flashcard for it. When you actually need to figure out a summary of all the things that you've ordered for a patient, how do you look that? Where is that going to be in Epic? That's another flashcard I made, right? So you'll see that part of the job in residency is not just being a doctor, it's also learning how to function in a very, very complex system. And so I created a lot of flashcards purely for the onboarding section of my residency. And if you go back to the organization tab I showed you, slide earlier, you'll see that I have an entire orientation flashcard deck that has to do specifically with where do I find the order for this? What do I do when this happens? And all of those things. So notice how the onboarding questions are very different from the doctoring questions. When there are doctoring questions like how do I actually treat hyperkalemia, that in and of itself is its own flashcard, and I still make a lot of flashcards related to that. So notice that I made flashcard related to the channel that's supposed to be responsible for contraction alkalosis. But this is very different than this flashcard, which is what documents do I need to write to discharge someone? And both are very important, and I use Anki for both of them as I've been adjusting through residency. Last but not least, I want to give a big shout out to this Core IM podcast, which is another place where you can get a lot of very clinically relevant information. Definitely give it a listen. It's entirely free, and internal medicine is important for anyone. Everyone needs to know basics of internal medicine. So I love this podcast. Give it a listen. So hopefully this all gave you a great insight into how I've been using Anki in residency, the organization of my decks, the fact that I have a lot of knowledge from UptoDate, and last but not least, the fact that your job requires you to not just be a good doctor, but also understand the logistics of how to make that happen. So if you enjoyed this video, please drop a like, comment, share, subscribe, and I'll see you all in the next video. Thanks for watching. Peace.